Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and brain cells to die. Alzheimer's disease is the most common cause of dementia. Dementia is a term for the inability of a person to remember, think, or make decisions as a normal person would. As of 2022, more than 6 million Americans of all ages have Alzheimer's. And the numbers will continue to grow. In our previous video, which we suggest you watch, we explained different kinds of foods that could cause Alzheimer's or even worsen it. This video will explain the early warning signs of this disease that you should not ignore. One thing to note about this disease is that the symptoms progress slowly over several years and worsen as the disease progresses. At the early stages, they could be dismissed as signs of old age. To this end, early detection is important because it makes room for better treatment and management. Here are 7 early warning signs to look out for. Number 1. Forgetfulness. Forgetfulness is an early sign of Alzheimer's disease. People with Alzheimer's could forget about recent conversations or events, or forget the names of places and objects. If you have Alzheimer's, you could tell your wife to pass you the jug at the dining table while pointing at the cup of water. You could also forget what you ate for breakfast in the morning. Alzheimer's could also make you forget dates, days, and years. Forget important dates like your birthday. Forget important data such as passwords and codes. And address people with different names. Number 2. Misplacing things. This could also be an early sign of Alzheimer's. If you have Alzheimer's, you could keep things where they shouldn't be kept, only to realize later that you misplaced them. You could also damage things unintentionally. You could even be looking for something you are holding right in your hands. While other illnesses and diseases could cause these symptoms, they are a sign of a memory problem and could be an early sign of Alzheimer's. Number 3. Difficulty completing familiar tasks. People with Alzheimer's usually find it difficult carrying out their daily familiar task. There are other illnesses and diseases that can cause this. But it could be an early sign of Alzheimer's disease that should not be ignored. Number 4. Confusion or trouble thinking straight. If you have Alzheimer's disease, you could have trouble thinking of the right word to write or say during a conversation. Alzheimer's puts you in a confused state of mind. This confusion comes with the inability to focus or concentrate on whatever you are doing, with poor judgment or finding it hard to make decisions. Number 5. Lack of comprehension. Alzheimer's can also make it difficult for you to follow up during conversations. When you have this disease, you could find it hard to understand simple messages or instructions at work. You could also be asking too many questions and repeating the same ones, even after they have been answered many times. Number 6. Having irregular memories. Alzheimer's could make you say things that did not happen. For example, you could say you bought your wife a car when you did not. You could make false claims over things, like boldly saying that you attended an event when you didn't. This is your mind, tricking you into believing that you have done what you previously thought about doing. You could also remember certain details of things that happened a very long time ago while forgetting recent events. Number 7. Emotional changes. Emotional changes can be an early sign of Alzheimer's disease. However, this varies with people. People with Alzheimer's undergo mood changes in the early stages. If you have Alzheimer's, you may become too happy or sad. You may become too quiet or noisy. Patient or impatient, too soft or rigid. These emotional changes can be warning signs of Alzheimer's disease and can only be noticed by family and close friends. If you notice any of these warning signs, talk to your doctor, especially if you are above 50. Remember, early detection is important for proper treatment and management of this disease. Thank you for watching. If you have any questions, leave them below. And don't forget to subscribe to our channel for more informative videos.